Okay, terrific. I want to welcome everyone. On behalf of myself and Rochelle Dicker, we're co-chairs of the research team at the medical school here at UCLA in health equity and translational social science. And we co-sponsor this social medicine seminar with the Center for Social Medicine with additional support from the Rangel Endowment. So I am very glad to see everyone here. We have such an exciting presenter. We're thrilled that she's now here with us at UCLA and leading so many innovative new initiatives. So Dr. Veronica Terriquez is the director of the UCLA Chicano Studies Research Center. She holds faculty appointments in the Cesar Chavez Department of Chicano and Chicana Studies and Central American Studies and the Urban Planning Department. She's trained as a sociologist. Her research focuses on health, social inequality, civic engagement, immigrant integration, and youth transitions to adulthood. She received her PhD in sociology at UCLA, so she's from us, her master's degree in education at UC Berkeley, and her BA in sociology from Harvard. Informed by over 2 decades of connections to social justice movements in California, much of her research has implications for local and regional policies affecting Latinx, immigrant, and other low-income communities of color. Her research has been published in the American Sociological Review, Social Problems, Social Science and Medicine, Sociological Quarterly, Gender and Society, Community Development, Education Policy, and many other journals. And she's co-authored with colleagues and students over 50 widely disseminated research reports on labor, community, and youth organizing. She's writing a book on how grassroots youth organizing is shaping the political incorporation of second-generation immigrant youth. And we are so happy to have her with us today. Thank you so much, Dr. Terriquez.
Thank you, Professor Helena Hansen. It's such an honor to be able to present to this group, and I appreciate the invitation. I also want to give a shout out to Ethel Rojas, who organized a lot of this meeting behind the scenes. Today, I'll be presenting my research on youth organizing and youth leadership development and its implications for health and well-being. And I'm going to share my screen. And while it comes on, I also want to thank the co-sponsors of this event, the research theme in health equity and translational social science, the Rangel Social Medicine Grand Round Series, and also the Center for Social Medicine and the Humanities. So I'm going to get right to it. So as we all know, young people of color, BIPOC, Black, Indigenous, people of color, young people have been experiencing heightened stress. And the stress isn't new. It was, young people were experiencing it before the pandemic. And in particular, young people who come from low-income, immigrant, refugee communities of color have disproportionately borne the brunt of a whole range of impacts for generations. And these impacts of poverty, racism, sexism, homophobia, and policies that exacerbate social inequalities have lasting impacts not only in their youth, but throughout the life course. And in the last few years, the pandemic, the recent racial unrest, increased gun violence that we're seeing in recent months, the climate disasters, the challenges they and their families are facing in paying rent have really exacerbated the health conditions, the mental health crisis that young people are experiencing today. And we've known for a while, and this has gotten worse, that mental health services, especially culturally appropriate mental health services, remain quite scarce in vulnerable and low-income communities. They also remain scarce in more affluent communities. So we've got a really serious problem here in terms of, our institutions, our state institutions are not providing sufficient mental health and healthcare for all young people, especially those who come from multiply marginalized communities. Now, oh, my screen's freezing a little bit. Okay, so we known for a while that youth organizations working in high poverty communities have served as an important intervention for young people. And these interventions have really had multiple impacts. And I want to show you these impacts, but my screen froze, so maybe it'll unfreeze a little bit. So the research has shown that young people who participate in grassroots youth organizing groups that engage them in campaigns, as well as other leadership youth organizations, can benefit in multiple ways from spaces that focus on their identities, their culture, and also address the needs of their communities. And these positive outcomes include learning civic knowledge that's not learned in high schools, also acquiring a range of civic skills that allow them to impact change locally and eventually sometimes at broader geographic scales. We also know from this research that social emotional learning occurs in a lot of organizations that serve, I don't want to say all organizations, but grassroots youth organizing groups with a track record do a good job at raising social awareness and enabling young people to develop socio-emotional control and also reduce their risky behavior. There's also growing evidence that youth organizing groups and leadership organizations can have a positive health outcomes. Now I'm hoping my screen unfreezes. So I'm going to stop my share for a little bit and see if that fixes it. Because I really want you to show you some data points that I think are really important to show the evidence that I have around the health impacts of youth organizing. So just, sorry about this. Give me a minute. Okay, let's see if we have better luck this time. I really apologize for this. All right, so there's an emerging line of work that focuses on radical healing. The concept of radical healing was in large part popularized by Sean Ginwright, who looked at youth organizing groups and noticed that there was explicit anti-racist activities that really empowered young people psychologically. And other scholars in the fields of education and social psychology have continue to do research along this line and have identified practices that specifically name the psychological trauma and harms caused by historical as well as ongoing oppression. Some of this research also highlights how young people develop empowered collective identities that enable them to be proud around their racial identity, gender identity, immigrant identity, and other identities.
Are you able to make screen full screen? Sorry to interrupt.
Okay.
There we are. Great.
Okay. Thank you for that. I hope it doesn't freeze. Okay. And also, some of these practices encourage critical analyses that counter a lot of the negative stereotypes that young people face in schools and the communities and by popular media. These practices often invoke ancestral and cultural traditions, use the arts. And one of the things that Sean Ginwright and others have shown is that they inspire hope and civic action. A lot of this great work has been qualitative. And so what I see myself doing here is bringing a quantitative analysis to show some of the impacts of healing and self-care practices that have been adopted by some grassroots youth organizing groups. And today we hear a lot about healing and self-care, and these terms are thrown out a lot by people who are organizations that are trying to profit off of us and young people who are trying to sell products that promote wellness. But what I'm talking about here is healing and self-care practices that are collective in nature and really think about not only the well-being of the individual, but the well-being of the communities, as well as repairing current and past harms. So what I've been trying to think through is how to bridge some of the literature and education and social psychology, and to some extent in sociology, with research in public health and other research on the neurological development of young people. And this research is starting to show that these interventions, certain types of interventions, might have lasting effects on young people's health. For example, we do know that some health education, although not all, there's different qualities and different types of health education that can reduce risk-taking and promote informed and healthy behaviors. We also know that spaces that form social networks can provide supports and information that encourage healthy behavior and can create a sense of belonging among young people. There's also emerging research that quality interventions can facilitate neurological adaptations and behaviors that enable young people to better handle adversity in their lives now and in the future. And I'm hoping this both quantitative and qualitative research might inform some of the research done in neuroscience and other types of medical types research that I don't do as a sociologist. So I want to give the people in the audience a little bit more background on youth organizing, because I suspect there's some people here who are less aware of the extraordinary work that's been done for more than a couple of decades by grassroots youth organizing groups to engage Black, Brown, and Native American, refugee, Asian American, Southeast Asian youth around addressing root causes of social problems in their communities. And I've been connected to the youth organizing world since the 90s, but have studied it more systematically throughout the 2010s when we saw the rise of the undocumented youth movement. We saw a lot of young people getting involved in Black Lives Matter efforts, and also getting involved in efforts around environmental justice, LGBTQ rights, and other issues that affect primarily low-income BIPOC communities. And what I've noticed over the last several years is that these organizations have been a lot more attentive to well-being. They've appropriately challenged social movement organizations led by elder generations that have really not adequately attended to the mental health and well-being of activists. And so there's been concerted effort, particularly since 2013, moving onward, to really think about wellness, health justice and wellness as part of, or as a central part of programming of grassroots organizing. Another feature of youth organizing in the last decade or so has been that it's become increasingly intersectional. And so young organizers have been attentive to the ways in which overlapping identity markers, race, class, gender, legal status, sexual orientation combine to form different forms of social marginalization and sometimes privilege. And this intersectional approach to providing programming for young people, as well as engaging in campaigns, has attended to efforts that really name and tackle multiple layers of social inequality. So for example, We see the Black Lives Matter movement that's not just focused on race, it's also focused on gender and LGBTQ issues. The undocumented youth movement was also intersectional and continues to be so today. Okay, so I've collected data on youth organizing for the last decade, and what I'm going to share is some results of surveys, interviews, and participants' observations that I and a huge research team of students have collected since 2016. And I have to give a shout out to the students, the grad students and undergrads who really did incredible work in surveying, interviewing, and conducting participant observations across the state of California. There's too many to name, and I know that some of them are here, so I want to thank you. So over the last half decade, I managed to collect surveys from 171 staff of youth organizing groups, as well as some leadership groups that have a social justice agenda. And I distinguish between youth organizing and leadership groups with a social justice agenda because some groups don't explicitly engage young people in campaigns, although they do work to address racial justice issues and provide leadership opportunities for young people of color. I've also conducted surveys with young people in youth organizing groups. This is a subset of the larger 171 organizations. All of these youth organizing groups are located in high poverty communities, and the students and I have interviewed 200 young people in these communities. And we've also conducted occasional participant observations, although I'm not claiming to have done an ethnography here. It's occasional participant observations that help triangulate some of the survey and interview data. So the surveys from staff of youth organizing and youth leadership groups give us an insight into the types of healing and self-care practices that are incorporated into the programming of youth organizing groups. The survey shows that, at least among those that I surveyed, almost half reported to engage their members in what is called healing circles at least once a month. Another 13% did this less often. It could have been biannually or at an annual retreat or as needed. But healing circles tend to be spaces where young people sit in a circle, often facilitated by a staff person or other community member, and they tend to share things that are going on with their lives. Sometimes they're processing difficult events, such as a shooting, a fire, something that happened in their community. Or they're just checking in. They're just checking in to see how they're doing. And so organizations can vary in the time they spent in doing these healing circles. As we've observed, following some organizations across the state, sometimes these circles are 15 to 20 minutes, sometimes they last hours. So unfortunately, I don't have survey data on the types of healing circles that organizations sponsor or regularly engage their members in, but we know that there's a lot of variation. A good number of groups also engage their members in mindfulness exercises. This includes breathing, exercising, stretching, taking time out to really reflect on an issue or a topic. And so there's a range of these as well. Some groups also engage their members in support groups, writing circles, meditations, spiritual rituals that are often drawing on ethnic cultural traditions. And there's other groups, a small proportion of groups that involve their members in what's called forward stance. And this is a form of Tai Chi that engages mind and body and encourages practitioners to embody positive social change. So this kind of just gives you a sense of the types of practices that organizations offer. And I should note here that in the course of the latter half of the 2010s, I saw groups engaging more and more in these types of healing practices, and organizations were sending their staff to trainings. And so we saw quite a bit of frequency of these practices right before the pandemic. So prior to the, I'm going to take you a couple years earlier, back in 2016, before some of these healing practices were as widespread, I did manage to survey 1,396 students with the help of many undergrads, grads, community college students, and some high school students. And we learned quite a bit about the demographics of these young people, as well as the frequency of those participating in the 98 organizations that we surveyed. And because we were doing this in California, in low-income communities, the overwhelming majority of the young people were Latinx. However, I should note that African-American young people were pretty well represented in many organizations and comprised 17% of the young people. Asian American young people were also well represented, particularly Southeast Asian youth. The majority of young people who participate in these organizations tend to identify as female. Back then in 2016, only 1% identified as non-binary. I do know, I sense that this percentage has gone up quite a bit since 2016, since it's become more acceptable to identify as non-binary. The average age of young people was 17, although we did survey young people ages 13 to 26. And the majority of young people that we surveyed were what we call veteran members. That means they were part of their organization for over a year. And I should also note that organizations differed in the frequency in which they met with young people. So just under half met with their organizations twice a week. So when we surveyed young people, we asked them what kinds of activities that they were involved in, whether they had participated in a protest, whether they went door to door to collect signatures or register or educate voters. We asked them if they planned activities and events or gave a presentation. But we also asked them if they participated in activities that promote health, healing, or emotional well-being. Specifically, we were trying to assess whether young people were participating in healing circles, meditation exercises, or other self-care activities. And in 2016, 39% of young people said that they had participated in these type of activities within their organization. And so what I wanted to find out was whether participating in these healing and activities or self-care activities actually had an impact on, or actually had a self-reported impact on the developmental and health outcomes of young people. And so we measured health-related outcomes and other civic and developmental outcomes. We asked young people if, as a result of their organizational participation, they had taken better care of their emotional well-being, physical health, if they learned about health issues impacting the community, and so forth. And they were asked to report whether the organization had no impact, a little bit of impact, some impact, or a lot of impact. And here, what I report here is the percentage of young people who reported that their organizational participation had a lot of impact. And so we see here that 44% of young people said that being part of a youth organizing group had a lot of impact on their emotional well-being. Another 37% said it had impact on their physical health, and so forth. We asked, importantly, because a lot of the healing activities and self-care activities incorporate culture and incorporate identity. I also anticipated that these healing activities would have an understanding, would promote an understanding of issues of social inequality, ethnicity and culture, gender issues, LGBTQ issues. At the same time, because people were sharing and talking to each other about issues and concerns, I also anticipated that healing and self-care activities would enhance their civic skills. And the survey results show that that was the case. So I conducted logistic regression, assessing the logistic regressions that predicted the odds of a lot of impact on different developmental outcomes. So I wanted to see if participating in healing or self-care activities increase the likelihood of young people saying that their organization had a lot of impact on their developmental outcomes. And I found that this was the case across the board. Young people who participated in healing and self-care activities as part of their organizations were more likely than those who did not to report that they were taking better care of their health and emotional well-being. They were more likely to report that they were learning about health issues that impacted their communities. Participation in healing and self-care activities was also associated with learning about issues of diversity and inequality. Young people were more likely to learn about their ethnic or racial group if they had participated in a healing circle or other self-care activity when compared to other similar youth. And they also learned about other people's cultures. They were more likely to learn about gender issues and LGBTQ issues. Finally, the survey results show that young people who participated in healing and self-care activities were particularly likely to develop civic skills. This included reporting that they improved their ability to communicate with others, speak in public, and organize around local campaigns. And so in the interviews that were conducted with survey participants, we found that young people really talked about the value of participating in healing circles or mindfulness exercises, and they could report feeling a lot better as a result of speaking with others around what was on their minds. They reported developing stronger relationships with their peers. They acquired strategies for de-stressing. So for example, I want to share a quote by a young man I call Robert from the Youth Leadership Institute in Fresno, who said, who was talking about his organization, and he said, they showed me different outlets, ways of how to slow things down, take the ease off your mind, try to reduce the stress level and just chill. So that was dope. Pretty much the healing circle lets you have the opportunity to take a lot of things that's on your chest in a safe environment. And so we heard this a lot from young people who were just glad to have the safe space to talk about what was going on in their lives. And one of the things that young people really appreciated was hearing from each other. This one young man from Asian Youth Promoting Advocacy and Leadership in Oakland said, I think the consistent groups check-ins are pretty healthy. I think coming to a big group, people feel more comfortable because they're not the only ones sharing, but it's other people sharing as well. It kind of doesn't make someone feel left out. And the collective nature of sharing, I think, really helps young people to feel like they're not alone in facing struggles. They're not alone in dealing with the stresses of everyday life, of growing up in a place like Oakland or Fresno or the Imperial Valley or the Eastern Coachella Valley or South Central LA. The group discussions where people get to just decompress and also process hard things. Things come up in these healing circles around, challenges families facing because a member has been incarcerated or somebody got deported, or just conflicts people are having with their friends or in their families and so forth. And I have a lot of quotes and I'm not going to share them all here because this will take too long. And I want to save a little time for the questions and answers. I just want to emphasize that the healing circles, the meditation exercises, opportunities to de-stress and talk about what's going on really helps build healthy bonds among young people. A lot of them also talk about how these spaces raise their consciousness about shared concerns that young people were going through. And they also learn to challenge gender norms, particularly the young men. They've tended to speak about how they learned to express themselves and let out their emotions, that in their families and their communities, they weren't taught to really share how they're feeling. And I want to give a shout out to the work of Uriel Serrano, UCSC graduate student, who's done quite a bit of work around how young men learn how to express their emotions through these healing circles and youth organizing groups. The other important thing to highlight is that these spaces aim to connect young people of color with ancestral traditions, and they often talk about being proud of how their families have survived and have found ways to build community and handle emotionally difficult circumstances. And finally, there was a lot of talk about how these practices help prevent young people from burning out from the organizing or the community work that they are doing. Now, this work is not easy, and it's actually quite challenging. Youth organizations that I studied engage in other types of programming around, engaging young people in campaigns, or they also did leadership trainings, media outreach. And so balancing the healing and self-care activities with other types of programming was often really challenging. There was often organizers would say there's never enough time to do it all. And another thing that came up once in a while is that in doing these healing circles or other discussions, it sometimes resurfaced trauma, or really challenging situations came up and staff felt like they were mandated to report to Child Protective Services, or it was sometimes really difficult for young staff to deal with the challenges that young people had. And they experienced trauma and burnout. And quite honestly, they weren't always prepared to deal with some of the things that came up in these discussions. And so a repeated theme that we heard from youth organizers is that, it was just so apparent that there isn't enough professional mental health services for young people and for the staff. And so doing this healing and self-care work can be overwhelming. And in speaking to organizers and frontline youth workers, since the pandemic, it's been really hard to do this. And in some cases, organizers have not gone too much into the healing and self-care work because it's a little too much to deal with, and they're not professionally prepared to hear what young people have to say. So we are at a crisis situation. The youth organizing groups and other leadership groups can help alleviate some of the challenges and trauma that young people face. But I think what this research points to is really the need for investments in culturally appropriate mental health services. And so, what my research is doing here is providing quantitative documentation of some of these practices and showing that, healing and self-care practices within grassroots youth organizing does enhance developmental outcomes around, young people learning to take better care of their emotional and physical health, and they're learning about health issues and processing difficult experiences with their peers also appears to enable them to become better community leaders. So I think what's important to highlight here is that these youth organizations are important resources for enhancing health and well-being in low-income communities of color. They're taking perhaps an unfair burden right now or during this difficult time. And so it just speaks to the need for more investments in mental health services that really are focused on young BIPOC people who experience multiple levels of stress. And so there's a lot of opportunities to build on this research. I'm hoping scholars could develop more precise measures of the types of healing and self-care interventions that exist in communities, as well as more precise measures of the developmental outcomes. I also think it's really important to unpack some of the best practices in healing and self-care. I think there are some organizations that really do this incredibly well and train the staff and prepare their staff to hold space for highly vulnerable youth. And there's other organizations that struggle to do this well because they're under-resourced and also don't have the capacity to train their staff. I also hope that there's more research that assesses the neurological responses to different types of community-based interventions. And I think this will help refine practice on the ground. So I've got to thank the funders of this research, particularly California Endowment, the Sierra Health Foundation, Weingart Foundation, and Irvine Foundation have also supported this work. Thank you all for being here, and I look forward to your questions.
Wow. Thank you for such profound and such, I don't know, societally impactful and timely work, Professor Terriquez. And I see a lot of emojis agreeing with me on the screen. So I have a couple of questions of my own, and maybe I'll start off just to give people a chance, unless anyone wants to raise their hand. Also, feel free to post questions in the chat if you'd prefer to write them out. But so I have two questions just off the bat. One of them you alluded to, you talked about post-COVID or, whatever, during COVID, how the landscape has shifted. And I noted that a lot of the data you presented was prior to the emergence of COVID. Now we see that COVID has hit the mental health of young people extremely hard. And I'm going to guess also particularly young people in the communities you're working in, because COVID itself has very disproportionately hit in those communities. So they're experiencing losses, and the Surgeon General came out with a declaration that suicide was among adolescents was a public health emergency. And then, of course, it's been a very interesting time for activism, on the heels of, Black Lives Matter and other groups really taking off at least in the public imagination and in the political space, the policy space. So I'm wondering if you'd want to reflect a little bit about COVID and what you've learned so far. I realize it's very difficult to do community-based research right now in this moment, but have you been able to get some updates about the landscape and what forms of self-care, if any, are being employed right now?
So the information I have is not systematic. I haven't done a survey since COVID. It's mostly based on more informal conversations and discussions with community partners. And COVID has been devastating on multiple levels. It devastated the staff, it devastated young people. So many young people had family members die. And in addition to that, there's an economic crisis. People are being displaced. And the racial uprising and the hate crimes towards Asian Americans too have further devastated young people. On top of this, we had fires in certain communities. So our partners along the Central Coast experienced that and disproportionately and in other places too. So it's been hard. It's been really hard, and organizations are struggling. At the same time, in some places, the organizations were the lifeline for young people. Not in all places, because it was hard to sustain the work, but those that managed to convene young people, it was like the one thing they looked forward to on a weekly basis, because school was not was not working for many of them. So they get to see their friends, they get to debrief about what's happening, also share information about how to stay safe during the pandemic, because we were hearing so much and things were constantly shifting. And so organizers were sometimes prepared with latest information, and they would share it. And then the young people would share it with their families. So like so many community-based organizations, they were on the front lines supporting low-income communities.
And I'm imagining that digital, Zoom mediated communications went way up as a tool of organizing as well as self-care.
Oh, absolutely. Yeah. Zoom and TikTok and a lot of, the social media providing important information around self-care and also how to stay involved, because that was important too for young people to stay involved, especially since they were involved in so much activism before the pandemic. Mm-hmm. It connected them and it kept them up to date on the uprisings and what they could do about what was going on. At the same time, we also know that too much social media also has negative mental health implications. So it's a double, it's not always good.
So I thank you for that. So many other questions related to that, but I want to bring to your attention a question in the chat about these strategies that you've been outlining of self-care that are used by the activists. Do they apply to older organizers, given the burnout that's happening in the social justice sector?
As far as I could tell, yes. I haven't been systematically studying with the young people, though. There's a lot of play and fun things and art, and that's really important, just to engage in activities that bring joy. It is part of the self-care.
Sure. I'd imagine older people could use more of that too. But wow. And I also see that someone is asking a follow-up question about social media, about the specific, social media mediated self-care and healing activities. Have you gotten any indication of that?
I have not studied the content of the social media healing and self-care strategies. I know that young people are sharing strategies and their organization are sharing strategies, but I have not done a content analysis of videos or postings or anything like that. I hope somebody does.
Yeah, and I was just thinking about some faculty that I've met at UCLA who look at digital media and race and thinking, oh, wow, this would be such a great collaborative project to take on. And so there's a lengthy question that just came up in the chat. I'm going to try to kind of distill it. And it's from a PhD student in special education. And she's talking about teaching and learning process being dependent on teachers being able and willing to build relationships, even with the most traumatized youth. That is a key question. Also in mental health care, speaking as a psychiatrist, do we want to allow psychiatrists to build relationships and not just write prescriptions? So teaching practices will make, so in many cases, teachers don't have the training. And this is someone writing in the chat who's working very fast to try to create resources, multimedia resources. I don't think there's an explicit question here unless the person writing would like to chime in verbally, but how does what she's describing resonate with what you're seeing among activists and youth serving organizations?
So I think that the challenge, I think the person writing speaks to a challenge that professionals are not trained to work with young people who have experienced trauma, and they may not have the cultural competencies to work with young people. And so this is why I think it's falling on the frontline youth organizers who tend to be in their early 20s from the communities that they serve or similar communities. So they often have the cultural competency to talk to young people and to engage with them, but they may not have the training to deal with some of the hardest issues that come up.
So as you're talking, I'm getting ideas for collaborative projects that I want to invite you to do with us in the psychiatry department here, and also at Drew University, where they're taking up racial historical trauma, and reinventing more community-based approaches. So let's talk if you're willing. And along those lines, I'm wondering if you want to comment on activism as therapy. And I'll give a little bit of background, which is, as a psychiatrist, I typically have seen people who are in the very kind of serious stages of crisis, right? Because no one reaches a psychiatrist by accident. Like, you have to try really hard to reach a psychiatrist in this country. So, so I'm seeing people who are, at very kind of critical crisis points, and there are definite racial and socioeconomic patterns to who ends up in those situations. When I moved here to LA, not too far before you did, before that I was working at Bellevue Hospital, New York City's largest public hospital, and in an addictions clinic that saw a lot of people who also had serious psychiatric diagnoses other than addictions. And many of them had been through foster care system. Many of them had been in the carceral system. They had had extremely hard lives, unstably housed. And we had, by sheer accident, a director of that clinic who was also a visual artist and very forward thinking and had a lot of arts-based groups, therapy and gardening, community gardening, very creative. And one thing that often came out of what ended up being patient-driven kinds of healing circles and discussions was some kind of consciousness, some kind of political consciousness about how did we end up in this big system. And so that was my experience, that, sometimes people got activated. And once they started thinking, oh, I'm a flawed individual, and started thinking, oh, this is a flawed society, it changed the game and they became politically active. And that seemed to help move them forward. And I've had colleagues, including, at Charles Drew, who have been thinking in a similar way. And so I'm wondering about that, activism as in itself therapeutic. Is that something that ever comes up, and what shape does that take?
So I think there's a couple of stages that you pointed to here. One is realizing that you're not the problem, the system's the problem. And that is huge. There's a political consciousness that happens in the course of some of these activities, particularly since organizers tend to frame these problems around as systemic problems, not individual problems. So that's for the first step. The second step is action. And within the context of youth organizing, young people are guided towards informed action. And they're training is scaffolded. So they're just not saying, the organizers aren't just saying to the young people, go change the system, right? They're giving them the tools to change it. So I think that if people are guided towards action, it could be therapeutic. And in particular, when young people and also adults participate in campaigns that progress, that there's moments of winning, small victories, larger victories, because I think that could be really empowering and could show people that they have power. So the organizing can also backfire when it's not strategic and people hit dead ends, and that could be really disheartening. So it's really important to make sure that the organizing is strategic and that organizations celebrate wins, even small wins along the way. And that's really what helps build people's confidence and allows them to process that they've had some impact, even if that impact is educating other people.
Fantastic. I wanted to call your attention to the question about, do you think young people can teach older organizers the strategies they employ around self-care and wellness?
Absolutely.
Especially to the point of play and joy as a part of that. What would that look like in your mind?
Absolutely. And I've seen it happen. And also I've interviewed young people who are saying, I'm teaching my mother and my aunties and dad better communication skills and reminding them to take rest and to care for themselves. And I also see it happening with younger organizers training their bosses and saying, hey, we need to slow down. We need to think about things because your generation's going to burn everybody out.
Wow. So that really speaks to the intergenerational aspect of this. And so given that you focused on youth organizers, are there other ways that you've seen youth organizers and older organizations of older activists interacting through your research? How do they relate to one another?
It's mixed. There are tensions. There are intergenerational conflicts. There's no doubt about that. And I see it the most with the boomer generation and millennial or Gen Zers. I think sometimes the Gen Xers are the bridge and sometimes they're the problem. So it takes a lot of time and relationship building.
Are there patterns to the kinds of conflicts that come up intergenerationally?
Well, I think the older generation often has what Liz Hannah Rubio spoke about yesterday at the CSRC event. They have this warrior mentality. It's like the more you work, the more committed you are, the more you show that you're supporting the community. And that's not healthy. And so to the extent that the older generation can unlearn these habits, it allows for more intergenerational organizing.
So among the brown and Black communities that you're studying, is there a generational gap in terms of how people understand self-care and even prioritize it? Because I'm thinking myself, my own mother, worked herself into the ground. And I think for her generation, that was pretty standard. I think society pretty much demanded it, but also it was just the expectation. If you're a Black woman in this country, you work your booty into the ground, right? And you do everything you can to earn money, to raise children, to take care of community, to take care of elders. And that's just the way it is. Whereas I'm wondering if the younger generations have a different consciousness, especially when it comes to immigrant families. I'm imagining that first generation immigrants, they're here to get as much done as they possibly can. And this idea of self-care might be a little bit,
it's like a luxury, right? It's seen as a luxury. And the older generation came up under different circumstances too. And so, sometimes we need it's important for younger folks to understand that the circumstances in which people were young adults or youth were very different. And the behaviors that were learned 20, 30, 40 years ago are not sustainable. And we know they're not healthy. And we have seen so many of our elders die prematurely or have health complications prematurely. And so, we just need to remind our elders that we want them to be around. So let's take some time to rest and reflect.
Well put. So I'm wondering, in the couple of minutes we have remaining, if you want to leave us with what's next, what do you see down the pike for projects that either build off of this one, or maybe you're planning a new turn?
Well, I'm hoping that there's a grad student or somebody out there that wants to continue this work. And I haven't a couple of grad students and I published a report on this, but I think there's extra data that I'd like to take to the next level and maybe think about publishing in a health related journal. So if there's a grad student or somebody else that wants to work with me on this, we have 200 interviews that need to be analyzed. So hello out there. And then the other work that I'm going to be doing moving forward is thinking about how to gather data to support campaigns around health justice and mental health resources. Because we need to figure out how our government institutions, our health institutions could better serve BIPOC communities, including young people. I mean, our elders too need to be better served as well.
Absolutely. Oh my goodness. So I'm going to be reaching out to you about, and many of us in psychiatry will be reaching out to you and at the health center. Such timely work. Thank you so much.
Thank you for having me. And thank you all for coming out here on a Friday afternoon. I'm sorry I had tech difficulties that threw me off a little bit.
Oh, not at all. This was fantastic. Thank you so much.